Doctor, I think the next word is supposed to be considering. That's right. Considering the very benign appearance of the x-ray. And what x-ray is that, doctor? The x-ray taken on that day. And the patient's course thus far, which is not consistent with a pure knee arthritis. I believe the total knee replacement surgery is not the treatment of choice. Isn't that what you said in April of 1999? Yes, you're right. Doctor, you told us earlier that you recommended a knee replacement at some point in time prior to that April 1999 note. Yes. And by April of 1999, you were of the opinion that that would not be the appropriate thing to do, correct? That would not be the next step to take, right? Doctor, do you have the radiology report from South Nassau Community Hospital from when she went in for the arthroscopy? Defendant's counsel, Judge, we have the film there. Do you have the report? It is in the hospital record. I have it up here. Can you find it for me? Yes, I have it here. They take x-rays of a couple of places as part of like a preoperative thing. They did a fair statement? Yes. And they take an x-ray of the right knee, 4 views. That's right. They note minimal lateral tracking at the patella is suspected. Is that right? Defendant's counsel, I'm going to object to reading from an x-ray report when the x-ray films are here. The court, he is reading from a document that is in evidence. I am going to allow it. Overruled. Defendant's counsel, note my exception because I do believe the court. Just a moment. The doctor is being referred to a record in evidence. I think you put it in. Go ahead. Defendant's counsel, subject to redaction, Your Honor. The court, may I see this document, doctor, please? The witness, yes, of course. The court, overruled. Why don't you ask the question again, counsel? There are 4 x-ray views of the knee taken. Yes? Yes. And it says after that minimal lateral tracking at the patella is suspected, correct? Yes. Is it fair to say, doctor, that the kneecap on the back side, the side that faces inside the knee, has a little ridge on it that fits in a groove and it travels within that groove? Yes. And if the ligaments that hold the patella in place for one reason or another are out of place, the patella tracks off to the side of that group? No, it is not a fair statement to say that. I can explain it if you like. I am sorry, I can explain why. It says minimal lateral tracking at the patella is suspected, right? Correct. And the x-rays show a certain abnormality. That x-ray showed a certain abnormality in the way in which the patella of the plaintiff's right knee tracked in September of 1996, correct? It is not an abnormality, it is a variation. It is within the range of motion normal. Lateral tracking is within the range of normal. Defendant's counsel moved to strike as not responsive. The court motion denied. Defendant's counsel exception. And by normal you mean some people track right down the middle and some off to the right a little bit and some track off to the left a little bit. Fair statement? Yes. And as time goes on, for some people that tracking that is right down the middle that causes some type of a wear between the patella and the inside of the knee, correct? No, this is an area of a lot of investigation and controversy. But for some people it does signify some type of a problem or the potential for a problem, correct? Yes, it can. And it also notes, this report, mild degenerative change with some narrowing and lipping of the medial joint margins seen. Is that correct? Yes. And no fractures seen, correct? That's right. Doctor, I have to impose on you for a minute. Can I have your copy of your office notes that are in evidence? Sure. Doctor, the last entry that you have on your office notes is handwritten, correct? Yes. July 10th, 2 days ago. And did the patient come to your office on that date? Yes, she did. Did you examine her at the request of the plaintiff's attorney on that date? Yes. And in fact, you examined her because the plaintiff's attorney asked you to read other reports that pertain to this case. No, I wouldn't make that direct connection. I examined her because there was some information that I normally would not include in part of a regular exam to determine how to treat Maria that would be helpful here. Doctor, you told us that you did measurements of the plaintiff's, I think it was calf or thigh. Defendant's counsel, how is that pertinent? The court, it is material. It is the thigh. 2 days ago, any time in 5 years you treated the plaintiff other than 2 days ago that you undertook that, yes or no? I wouldn't normally do that, no. And in fact, you did that at the request of the plaintiff's attorney, did you? Yes. And up until 2 days ago, but for the request from the plaintiff's attorney, there would have been no significance to you whatsoever. Fair statement? No, not at all. But it is nothing that you ever measured or recorded in the 5 years or 31 visits you had. I measured it by visual inspection and recorded it. I looked at the leg and can see it is atrophic, but I haven't measured it. I don't need the numbers. When is the first time you found her right thigh had atrophied? When is the first time you noted that in your record? Defendant's counsel, I object, irrelevant. The court, objection overruled. I don't know that I recorded it in the record. It has been present all along. From the first time you saw her in October of 1995? No, probably not, but most likely I have independent recollection from the notes. The thigh is smaller and it has been that way for quite a while, so it is something that I would look for. When you say it has been that way for...
So. The software says there was 223. How fast was that?
I had it at 200, but it could be. How's it?
It's a little tough. Should I read?
Yeah.